This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 2 video of the cementum, and in this video we will be discussing particularly with the classifications of the cementum. So in this video we will be discussing with the different types of the cementum. Okay, we will be discussing with the acellular cementum, cellular cementum, extrinsic fiber cementum, intrinsic fiber cementum. Okay, and our next topic will be difference between cementum and the bone. Okay, so we will know the difference. Okay, what is the difference, what is the main difference between the bone and the cementum, and at the last we will be discussing with the cemented tissue. Okay, so in the previous video we have discussed so that was the just introductory video to the cementum. In that we have discussed with the introduction to the cementum, and we have discussed with the properties of the cementum there. Okay, and in today's video, so this video is one of the important video of this chapter. Okay, so the topic that I am discussing today, this classification of cementum, is one of the most important and the favorite question for every examiner. Okay, so and also many of the students feels difficulty in this topic. Okay, so in the classification of cementum, so they just get confused. Okay, so I will try today to just clear all your concept in this classification of the cementum. And okay, so without delaying much, let's get started. So our first topic is classification of the cementum. So in this classification of the cementum, okay, we should know that, okay, we can classify the cementum on different basis. Okay, so we can classify cementum on different basis. Okay, so first of all, we will classify cementum on the basis that of the presence or the absence of the cell. Okay, whether the cell is present or whether the cell is absent. Okay, so the cell means cementocyte. Okay, so the cells that are associated with the cementum. Okay, so I will be discussing with that in next part of this cementum, but for today, okay, so this cell means the cementocyte. Okay, now, so I have prepared a proper table. Okay, so this table I have taken from the Orbans. Okay, so every content that I'm providing you, okay, so this usually I take from the Orbans. Okay, so you shouldn't have to read again that book. Okay, Orbans, so you can rely on my notes and prepare those notes properly. Okay, so okay, now in this acellular cementum and in this cellular cementum, so acellular means there is no presence of the cementocyte and there is presence of the cementocyte. Okay, so immediate cementocyte is absent here and here it is present. Okay, after that, deposition rate, so deposition rate in acellular cementum it is slow, and in the cellular cementum it is faster. Okay, so if there is no cell, you can think like that. Okay, so if there is no cell, so the deposition rate would be slow there, and if there is cell, okay, so it would form cementum fast and there is deposition rate is faster there. Okay, so you can just so this is just a technique to remember. Okay, you can just remember like that. After that, it is a first form cementum. Okay, so acellular cementum it is first form cementum, and after that cellular cementum is formed. Okay, in the next point, found mostly at the cervical third of the tooth, and it is mainly seen in the apical third and interradicular area through a thin layer of the, okay, through a thin layer is present all over the though a thin layer is present all over the root. Okay, so okay, cervical third of the tooth. Okay, so just think this is a root. Okay, just think this is a root of the tooth. Okay, so okay, just this is single rooted. Okay, so interradicular area, I'll draw double rooted tooth. Okay, so just think this is single rooted tooth and this is double rooted tooth. Okay, so this acellular cementum. Okay, so the acellular cementum it is found mostly at the cervical third of the tooth. It means that, okay, so cervical third means in the anatomy video I have discussed. Okay, so this is cervical, this is middle, and this is apex. Okay, so in the cervical third, mostly in the cervical third, okay, we just take in this portion of the tooth. Okay, so this is a cervical portion of the tooth, so in this portion there is acellular cementum, and in the apex region, okay, so in the apex region there is a cellular cementum. Similarly, in the double rooted tooth, so in this area, so this is cervical area. Okay, so this is cervical area. Okay, so there is a acellular cementum, and in the apex region, so this is apex region and this is interradicular region. Okay, so in those area Okay, so those three areas there is a cellular cementum. Okay, so you should remember like that. Now also called primary cementum, and it is also called a secondary cementum. Okay, and width is more or less constant here, and width can be highly variable. Okay, so width is more or less constant here. In ocellular cementum it is more or less constant, and in the cellular cementum width is highly variable. Okay, so you can remember this like that. Okay, so just think, as I have told here. Okay, so it is a first form cementum, so just you can relate this ocellular cementum with that of the pre-dentine. Okay, so it is just a technique. So just in the pre-dentine, in the dentine chapter where I have discussed with the pre-dentine, so I have told there pre-dentine is one of a constant layer. Okay, that is unmineralized, and when the mineralization happen, another new constant layer of the unmineralized dentine is formed. So that is a pre-dentine there. Similar here, ocellular cementum. So firstly ocellular cementum is formed, but when the cementocyte comes into it, it is changed into the cellular cementum. So similar, so the width is more or less constant, so you can relate like that way. Okay, so ocellular cementum have the width that is constant. Okay, so when the cell comes, it changes into the cellular cementum, and again newer ocellular cementum is formed. Okay, so you can just remember like that way. Okay, so this is a way to remember. Okay, our another point is surface fiber are well mineralized in this ocellular cementum, and in the cellular cementum surface fiber are partially mineralized here. Okay, so surface fiber I will be discussing properly in the periodontal ligament video, but for now just remember. Okay, so periodontal ligament, okay, so they are the collagen fiber bundles, okay, that is connecting the cementum of the root of the tooth with the alveolar bone. Okay, we I think we everyone know that. Okay, so the surface fiber are those portion of the periodontal ligament that are inside the cementum. Okay, just think, I will draw with another pen. Okay, so this is a periodontal ligament. Okay, so this is a periodontal ligament, and when it get into the cementum, okay, so this is a cementum here, so this is a cementum, so this portion of the periodontal ligament is called surface fiber. Okay, that is inside the cementum. Okay, so this the main function of the surface fiber is for anchorage. Okay, so in the next point now, incremental lines are regular and closely placed, and in the irregular and the placed wide apart with a variable thickness between them. Okay, okay, so incremental line are regular and closely placed here, but they are irregular here. Okay, so okay, so it is easy to remember. I will just recite all the points once again, so you just listen to me. Okay, so ocellular cementum and the cellular cementum. Okay, so ocellular cementum means cementum that doesn't contain cell, and the cellular cementum it contains the cell. Cell means cementocyte. Okay, now ocellular cementum, so as there is no presence of the cell, so the deposition rate would be slow there, and it would be faster in the cellular cementum. Similarly, ocellular cementum, it is a primary cementum and it is a first form cementum. A cellular cementum is a secondary cementum and the latter form cementum. Similarly, this incremental line are closely placed, okay, and regularly placed in the ocellular. In a cellular, it is variable and irregular. Okay, similarly, and it is mostly found on the cervical third. Okay, so cervical third, and the cellular cementum is found on the apex and the interradicular area. After that, the width, okay, so it is a bit constant in the ocellular cementum, but it is varying. Okay, so it is highly variable in the cellular cementum. And the surface fiber, it is well mineralized in the ocellular cementum, but in the cellular cementum it is partially mineralized. Okay, so how to remember this point? Okay, so I'll just tell you a technique. So in ocellular cementum there is just a absence of the cell, so there is no any cells. Okay, so there is just a minerals. Okay, so there is just a matrix and the minerals, so you can remember like that way. So surface fiber that is present there also in ocellular cementum, so it must be a mineralized. Okay, so you can remember like that way. So just you should link every point. Okay, so we have completed with this and in the next classification on the basis of the origin of the collagen fiber. Okay, so this origin of the collagen fibers. Okay, so one is extrinsic fiber, another is intrinsic fiber, another is a mixed fiber. Okay, so extrinsic fiber means the fiber that is developing outside, okay, from the cementum. Okay, so it is not being developed inside the cementum, so that is extrinsic fiber. Similarly, the intrinsic fiber means it is developing inside the cementum, and the mixed fiber, it is developing in the both. Okay, so it is in the middle line. Okay, it is at the boundary of the intrinsic and the extrinsic fiber. Okay, so extrinsic fiber, the fibers are derived from the periodontal ligament fibroblast. Okay, So the cells fibroblasts are present in the periodontal ligament, and they are responsible for the development of the fibers. So they are the extrinsic fibers. And the surface fiber, okay, so this extrinsic fiber, surface fiber means, so those extrinsic fibers, okay, so they are the extrinsic fiber, they finally change into the surface fiber when they just enter into the cementum. So it signifies that, okay, after that it is perpendicular or oblique to the cementum. Okay, so extrinsic fiber, they are perpendicular here. Okay, so you can see, and I have picture too, I will show you that. Okay, so they are just perpendicular and, okay, oblique to the cementum. Now in intrinsic fiber, fibers derived from the cementoblast. Okay, so cementoblast forms the cementocyte. Okay, and it also forms the fibers. So intrinsic fibers derived from the cementoblast. Okay, so this is very important. And similarly, they run parallel to the root surface and are perpendicular to the extrinsic fiber. And this mixed fiber, it is derived from the both. Okay, so both I think it is in the boundary level. Okay, so I'll show you one picture. Okay, so it is a rough schematic diagram that will clear your concept properly. Okay, okay, so just think, this is a root. Okay, so this is a root here, this is a root. Okay, and this whole thickness, okay, so this whole thickness, okay, so this thickness, okay, so this is a cementum. Okay, so I have drawn cementum wider here. Okay, okay, so this is a cementum. Okay, okay, now the thing you should remember from this picture. Okay, so this fiber, okay, so this fiber, they are actually the surface fiber, and they are derivative of the periodontal ligament fibroblast. Okay, so they are derived from the extrinsic fiber. Okay, so they are extrinsic fiber here, and they are present coronally. Okay, and that is similar with that of the ocellular cementum. Okay, so you can say that ocellular extrinsic fiber cementum is present in the this portion of the tooth, and the cellular, okay, so these are the cells. Okay, so this blue color cells you can see. Okay, so they are the cementocyte. Okay, and the canaliculi, okay, I think it is visible or not. Okay, so I have drawn small lines. Okay, small blue lines. Okay, so they are the canaliculi of the cementocyte, and they are directing outward, okay, towards the periodontal ligament. Okay, so this is also one of the important thing you should remember. Okay, so these are the cementocyte, and I will be discussing with this in the next video when I will discuss the cementocyte. But for now, you should remember this, that cementocyte, okay, so they are the cells of the cementum, and they contain the canaliculi, and those canaliculi are directed towards the periodontal ligament. And also this portion of the tooth, okay, in the apex portion of the tooth, you can see this black color fibers are present there. Okay, so they are the intrinsic fiber. Okay, and they are developing inside the cementum. Okay, so there are many ways to remember this. Okay, you just have to remember a small thing, that ocellular cementum and the extrinsic fiber are present in the coronal portion of the tooth, but this portion, in apex portion, as there is cell and as there is cementocyte, okay, so uh, there should be a fiber too. Okay, because the cementocyte are formed from the cementoblast, and the cementoblast forms the fiber. Okay, so fibers and the cells both should be present in those area. Okay, so in the apex it is cellular intrinsic fiber cementum, and in this portion, okay, in this portion they are the ocellular extrinsic fiber cementum. Okay, and this concept is very important to understand the classification of the cementum. You should remember this always. So cellular cementum always at the apex and the interradicular areas, and this ocellular cementum, they are present at the coronal and at the cervical third. Okay, this cervical third, and mostly at the middle third. Okay, okay, mostly at the cervical third, but some also at the middle third. Okay, so they are the ocellular cementum, and in the ocellular cementum there is extrinsic fiber, and that is deriving from the periodontal ligament. Okay, as you can see in this picture, and the intrinsic fiber, they derive from the cementoblast, and the cementoblast also give the fiber and the cells. Okay, so they both things, so they both which are the derivatives of the cementoblast, are present at the apex region. Okay, so just remember, cellular intrinsic fiber cementum at the apex, and the ocellular cementum, okay, ocellular extrinsic fiber cementum at the cervical third and the middle third. Okay, and also in later in this video itself, okay, I will be discussing with the mixed fiber. Okay, mixed ocellular mixed fiber, mixed cementum. Okay, so at that time, so this boundary line between this extrinsic and the intrinsic fiber, there will be mixed fiber. Okay, so I will discuss later. Okay, so we have a clear concept in this ocellular and cellular cementum, and also in this extrinsic and the intrinsic fiber. Okay, now we have, on the basis of these, okay, so on the basis of those fibers and the cell, okay, we have the Schroeder, okay, classified the cementum into the 5 types. Okay, and this is very very important in this cementum chapter. You should know this properly. Okay, so just focus here and concentrate here. Okay, so Schroeder classification. Okay, so Schroeder classified cementum into the 5 different types. Okay, 5 different types of cementum are there on the basis of the cells and the fiber present there. Okay, now, so our first cementum is a acellular afibrillar cementum. So acellular and afibrillar cementum, so the name signifies there is no cells. Okay, so it is acellular and there is no fiber, means no cell and the no fiber. Okay, so those type of cementum is a acellular afibrillar cementum. Okay, so those type of cementum are close to the cemento-enamel junction, limited to the enamel surface. Okay, I will tell this first. I will recite all those points and I will clear your concept properly. Okay, so it lacks the collagen, so plays no role in the attachment. Okay, so fiber means collagen. Okay, so as there is no fiber, so there is will be no collagen. Okay, so play no role in the attachment. Okay, it is clear. Now, formed when there is a premature loss of the reduced enamel epithelium protecting the newly formed enamel at the cervical region. Okay, so this ocellular afibrillar cementum, they are formed when there is a premature loss of the reduced enamel epithelium protecting the newly formed enamel at the cervical region. Okay, so they are formed there. Okay, so I will show you this picture once again. Okay, so just think, just listen to me. Okay, so I have told ocellular extrinsic fiber cementum here and cellular intrinsic fiber cementum here. Okay, so I have discussed with the only 2 type of cementum here. Okay, but now just listen to me. Okay, so this portion of the cementum, you can see it contain fiber and also ocellularity. Okay, but in this portion, okay, so I have not drawn any kind of fiber here. Okay, so in this cervical portion, extreme cervical portion of the root, okay, when there is a cemento enamel junction, okay, so when this cementum forms the junction with the enamel, at that portion you can't see any kind of the cell and also there is no any fiber present there. Okay, so this region of the cementum, this type of cementum is called the ocellular afibrillar cementum, that is near at the cemento enamel junction. Okay, so this is making junction with the enamel. Okay, in the next video I will be discussing the 3 different types of the cemento enamel junction there. Okay, so here at the region of the cemento enamel junction where there is no fiber and where there is no cell, so that is a ocellular afibrillar cementum and that lacks the collagen, there is no any fiber, so it doesn't play any role in the attachment. Okay, so you should know this. Okay, and it is also formed when there is a premature loss. Okay, so reduced enamel epithelium. Okay, so this is also one of the important thing. Okay, so junctional epithelium are present, are there. Okay, so I will be discussing with all those stuffs in the upcoming chapter, oral mucosa, in the amelogenesis. Okay, so there we will be clear with this reduced enamel epithelium, REE. Okay, but for now just remember it is formed due to the premature loss. Okay, if premature loss of the reduced enamel epithelium protecting the newly formed enamel at the cervical region. Okay, after completing this ocellular afibrillar cementum, we will discuss with the other important types of the cementum, and I have discussed this properly previously too: ocellular extrinsic fiber cementum and cellular intrinsic fiber cementum. Okay, so the proper table is here. Okay, and you should know all the points, remember all those points from this table, and I have taken this table from the Orbans. Okay, so now just listen to me. So AEFC, that is a short form of this ocellular extrinsic fiber cementum, thickness is 50 to 200 micrometer, and CIFC, cellular intrinsic fiber cementum. Okay, so AEFC, it is located from the cervical to the apical third. Okay, so I have discussed in this picture too. Okay, so from the cervical third to the apical third, okay, so there is a ocellular extrinsic fiber cementum, and in the apical third there is cellular intrinsic fiber cementum also in the interradicular areas. Okay, so this apical third and at the forcation. Okay, so at the forcation there is cellular intrinsic fiber cementum. Previously I have written mistake here, so I have corrected it. So apical third and the forcation. Okay, so forcation means interradicular area. After that, AEFC. So as I have discussed in ocellular cementum, so ocellular cementum are the primary cementum and the cellular cementum are the secondary cementum. So primary cementum means formed earlierly, formed later, and during the repair. Okay, so they are the CIFC, they are the secondary cementum. Okay, as they are cellular, and AEFC are the primary cementum as they are ocellular. Now, non-collagenous proteins like tenascin, fibronectin, osteocalcin are absent here, but non-collagenous proteins are present here. So one thing is absent here, one thing is present here. So it is very easy to remember. Okay, so the non-collagenous proteins like tenascin, fibronectin, osteocalcin are absent in this AEFC, but they are present in this non-collagenous protein. Okay, but they are present in this CIFC. Okay, similarly the growth factors like TGF, beta and IGF are not seen here, but the growth factors are present here. Okay, in the cellular intrinsic fiber cementum. Similarly, the proteoglycans are absent here, but they are present here. Okay, similarly cementoid is absent and seen on the surface here. Okay, so in the cellular intrinsic fiber cementum, cementoid it is present, it is seen on the surface. Okay, and the cementoid I will be discussing later in this video. Okay, so we have topic of this cementoid in later in this video itself, so don't worry in this cementoid terminology. So cementoid it is absent in this AEFC and it is present in the CIFC. Okay, now in another point, probably the only type of the cementum in the single rooted tooth. Okay, so in the single rooted tooth mostly AEFC is present there, but at the apical region it is a present there is present of the CIFC. Okay, but mostly there is AEFC in the single rooted tooth, but in the maybe absent in the single rooted tooth. So if this is a, so it is quite of comparison type of difference. Okay, so probably the only type of cementum. Okay, so mostly AEFC is only present in a single rooted tooth, but also CIFC. Okay, similarly AAC, okay, ocellular ocular cementum are also present there. The thing you should focus is to take just concept. Okay, so they are just probabilities. Now another function is the main function is the anchorage. Okay, so as they are the, as they have the extrinsic fiber, similarly they are in adaptation and the repair. Similarly in another point, slow formation. Okay, so you can relate this with the ocellularity. Okay, so in the ocellular cementum there I have told there is no cell, so there will be slow formation. Okay, so slow formation, rapid formation here in the cellular intrinsic fiber cementum. After that, incremental lines are closer here, but they are farther apart. Okay, so this also you can relate with that of previous ocellular and the cellular cementum. Okay, so there was a regular and the closer incremental lines. Okay, so incremental lines of Salter. Okay, we used to tell incremental line of Salter in this cementum. We will be discussing in next video, but for now incremental lines are closer here, but they are further apart, and cementocyte is absent here and they are present there. And cementoblast that don't express PTS receptor, okay, parathormone receptor, but they express PTS receptor. Cementoblast derived from the inner cells of the dental follicle, and here cementoblast are derived from the hot-wick epithelial root sheath. Okay, so I'll just again once again recite all those points and you just listen to me. Okay, so AEFC and CIFC. So AEFC means ocellular and also extrinsic and cellular intrinsic. Okay, so ocellular extrinsic fiber cervical third to the apical third, CIFC at the apex and the focus area. Similarly, it is a primary cementum, and as they are ocellular, and this is secondary cementum. So just now after that you just remember this. Okay, so ocellular slow formation, rapid formation in cellular, similar incremental line closer, further apart here, and cementocyte absent here, here it is present here. Okay, so after this again you come here in the non-collagenous protein, and just remember non-collagenous protein like tenascin, osteonectin are absent in AFC, but they are present in CIFC. After that, growth factor, they are also not absent in AEFC and they are present. Okay, as there is no any kind of cells. Okay, you can remember like that way, as there is no any kind of cells in the ocellular extrinsic fiber cementum, there will be no any kind of proteins there. Okay, so that is just a common sense. Okay, you should just relate all those points. So there is no cell, so there is no collagenous proteins are absent, so there is no any kind of protein there, and also there is no any kind of the growth factor present there. Also there is no proteoglycans, and cementoid is also absent there. Okay, so cementoid is also absent in this AFC. So growth factor, proteoglycan, cementoid, non-collagenous protein all are absent in AFC but are present in the CIFC. Okay. After that, probably the only type of cementum is single breed. So this is a kind of probability, and main function is anchorage, and here it is repair and adaptation. And we have completed this slow formation in incumbent and cementocyte, and this cementoblast. Okay, so this is important. So it doesn't express PTH hormone receptor in AFC but express here in CIFC. Okay, so also you can remember like that way. Okay, so there is no any kind of cells. Okay, and there is no any kind of protein, there is no, so if there is no protein, so this PTH hormone is also a protein. Okay, so there is no use of this PTH receptor, so there is a absence of this PTH receptor in this cementoblast of the AFC. So you can relate like that way. Okay, and the important thing you should remember is that, okay, so cementoblast that is present in this AFC is derived from hardwood epithelial root sheath, but the cementoblast that is present in the CIFC is developed from the inner cells of the dental follicle, and I have discussed with all those steps in the development of the tooth, so you can prefer those video. Okay, after watching all those videos you will be just linked. Okay, here I can't explain everything, you should know that. Okay, and you should watch those videos too. Okay, so I think I have prepared the proper note also, and also a proper lecture on the development of the tooth. You should watch that, and that is the foundation base topic of this oral histology. Okay, every points, everything of that chapter comes in every chapter of this oral histology, and you should just prepare that chapter well. Okay, now we have completed these three types of the Schroeder classifications. Now our fourth type of cementum is a cellular mixed stratified cementum. Okay, so cellular mixed stratified cementum. Okay, so so just go to this term. Okay, cellular means there is presence of the cell. Okay, so one thing it is clear that there is a cell. Now another point, it is mixed. Mixed means, which kind of mix means, mixed means you should remember that. Okay, so it is containing both extrinsic and the intrinsic. Okay, so it is at the transition, so as I have discussed previously, extrinsic fiber, intrinsic fiber, and the mixed fiber. So in mixed, it is derived from the both. Okay, so there is both extrinsic and the intrinsic fiber present there. After that, stratified. So stratified, it is the term of the histology. So stratified means, okay, so this is one layer of the cell, and above that another layer of the cell. Okay, so there is a strata. Okay, so strata means layer, so there are different layers, so that is called stratified. Now the cementum. So the cellular mixed stratified cementum means the cementum which contains the cell and also contain both kind of fiber, and they are in stratas. Okay, so this extrinsic fiber cementum, okay, so that is present in one layer, and intrinsic fiber cementum CIFC is in one layer. Okay, so AEFC and CIFC are both in the different layers, and they are forming the stratification, so they are called the stratified, and that cementum is collectively called cellular mixed stratified cementum. Okay, so from this terminology you can just get into the topic. Okay, now we will just learn these points. So in this type of cementum, CIFC alternates with the ocellular extrinsic fiber cementum. So the same thing I have told here previously here itself. Okay, so CIFC alternates with the AEFC. Okay, and they form the layers. So just think, this is a layer of the AEFC, and this is a layer of the CIFC. Again, this is a layer of the AEFC. Okay, so there are the stratas, there are the layers of the ocellular extrinsic fiber and cellular intrinsic fiber. Okay, after that it is formed by the cementoblast and the fibroblast. It is sure a cementoblast forms this CIFC intrinsic fiber, and fibroblast form the extrinsic fiber. Okay, after that, present at the furcation area and at the apical third of the root. Okay, so one thing I should tell you clearly. Okay, so previously I have told that you should remember at this portion. Okay, there is a cellular intrinsic fiber, means there is a cells, okay, and there is a fiber, okay. But also when you will study deeply in this apical third region, okay, we have both cellular intrinsic fiber cementum 2 and cellular mixed stratified cementum 2, okay. So in some portion of this apex of the root you will see the stratification, you will see also the uh, this extrinsic fiber too, okay. There as extrinsic fiber, also the extrinsic fiber cementum AEFC is also present there. So in some areas of this apex and also in the furcation, okay, there is presence of this cellular CIMSC, okay. So cellular mixed stratified cementum. So the furcation area and the apical third of the root, okay, and the thickness is 100 to 1000 micrometer, and extrinsic fiber don't assist in the tooth anchorage, okay. So extrinsic fiber that is present in this cellular mixed stratified cementum, and they don't assist in a tooth anchorage, and they are not having this surface fiber, okay. So as they does not assist in anchorage, and they are not a surface fiber, okay. So you should just remember from this type of cementum is that, okay, so there is a cellular mixed stratified cementum, which means there is also a cell, there is also two kinds of the fiber, and also there is the stratification, there is the layer, okay. So CIFC alternates with the AEFC. After that, cementoblast and fibroblast secrete two kinds of fiber, one is intrinsic, another is extrinsic, present at the furcations and the apical third, similar with that of the CIFC, and thickness is 100 to 1000 micrometer. And the important thing that can be framed into the question in the MCQ exam is that extrinsic fiber don't assist in the tooth anchorage. Mostly the extrinsic fiber that is present in the AEFC or cellular extrinsic fiber cementum is assisting in the anchorage, and they are the surface fiber. But here the extrinsic fiber that is present, it doesn't assist in the anchorage, okay. So they are not a surface fiber, okay. So after this, another fifth type, okay. In this cellular mixed stratified cementum also we have another type, that is cellular mixed fiber cementum, okay. So in this cellular mixed fiber cementum, simply there is extrinsic and the intrinsic fiber, also there is presence of both the fiber, and they are not in a stratified pattern, they are just mixed, okay. So they are just mixed, and the location of this cellular mixed fiber cementum is also similar with that of the cellular mixed stratified cementum, and also that similar with that of the CIFC, okay. Okay, so this cellular mixed fiber cementum is just similar with that of the cellular mixed stratified cementum, but the difference is that there is a stratification, but in this CMFC, okay, not CMSC, CMFC, there is no strata and there is no stratification present in this, and this type of cementum is not in this Schroeder classification. You should also know that. I'm just telling extra, okay. This I have found in the book, and you should also know about this, okay, but it is not present in the Schroeder's classification, okay. So our fifth cementum in this classification is the intermediate cementum. So intermediate cementum thickness is 0.5 to 0.8 micron, okay. So it form of the secondary cellular intrinsic fiber cementum, okay. So it is a kind of the CIFC, usually at the apex of the tooth, okay. Also it is present in the entire root, okay. So there is a context to it, entire root, and contains entrapped cellular debris derived from the root sheath or the odontoblastic layer, and also in the region of the ASC hyena, the Hopewell Smith, okay. So just listen to me about this intermediate cementum, okay. So this intermediate cementum is the cementum that is present at the apex region, okay. It is present at the apex. Okay, I'll show you in the picture, then you will be more clear, okay. Just think, okay, I'll draw with another pen here, okay. I have told previously, so this is a cementum, okay. So this is a thickness of the cementum. Now this is a cemento-dentinal junction, so there is a dentine inside and this is a cementum here. Now at this junction we have one intermediate layer, okay, intermediate layer of the cementum. Most of the scientists, okay, most of the observers say that, okay, so this is a layer of the dentin itself, but some say no, it is not a dentin, it is just a cementum, but that is a kind of the intermediate cementum separating the dentin and the cementum. Okay, so this intermediate cementum is a kind of the 50-50 dentin and 50-50 cementum. Okay, that is present between both this dentin and cementum. Okay, so it is present at the boundary of dentin and the cementum. Okay, so they are the intermediate cementum, and that intermediate cementum, that cementum, okay, when it is present in this AEFC region, okay, means cervical third to the apical third, then it is called hyaline layer of Hopewell Smith. Okay, and we will be discussing properly with this in a next video, but for now just remember the cementum, okay, the layer of the cementum that is just present between the dentin and the cementum in the region of the cervical third to the apical third, that is the intermediate cementum, that we call the hyaline layer of Hopewell Smith. Okay, that is a hyaline layer of Hopewell Smith that I have mentioned here in the region of AFC, hyaline layer of Hopewell Smith, but at the apex of the tooth. Okay, but here in apex region, okay, but here in this apex region, okay, I think it is visible now. Okay, so here in this apex region, okay, so this intermediate cementum, okay, so this is called intermediate cementum. Okay, so this cementum is called intermediate cementum, and here it is called hyaline layer of Hopewell Smith. Okay, so I think you will you have been clear in this now. So it forms a secondary form of the secondary cellular intrinsic fiber cementum. Okay, so it is kind of that now present at the apex of the tooth, and this entire root I have mentioned this, okay, because it is also present at the apex and also at the this AEFC region. Okay, but in the AEFC region we call hyaline layer of Hopewell Smith, but in the apex region we call intermediate cementum. Okay, so the name is different at different places, and it contains the entrapped cellular debris derived from the root sheath or the odontoblast layer. Okay, from root sheath or the odontoblast layer, it is cellular debris are entrapped into this intermediate cementum. Okay, and it have no any kind of functional significance and not involved in the tooth attachment. Okay, so there is no any kind of functions of this intermediate cementum, and the thickness is very thin. Okay, 0.5 to 0.8 micron. Okay, okay, so we have completed with the proper classification of the Schroeder classification. Okay, so Schroeder classification is one of the important classification of the cementum in this chapter. Okay, and you should know it properly. Now our next subtopic is cementum and the bone, and in this cementum and the bone, okay, so we have I think we should discuss this in the first video itself, but I thought to discuss in the second video. Okay, so cementum bone, so it is avascular and also non-sensitive, non-innervated. Okay, dental connective tissue. Cementum is a avascular, non-innervated dental connective tissue. Okay, and it is a vascular sensitive. Similarly, no resorption and no remodeling, but here is a resorption and the remodeling present, and mineralization of the cementum doesn't take place by the matrix vesicle, and it is by the matrix vesicle here. So I have just mentioned 4 points, you can just remember it. Okay, after that, and this is one kind of the viva question. Okay, so this avascularity and non-sensitivity. Okay, so it is one of the important, so I have written with the red color pen here, and no resorption, no remodeling, resorption and remodeling present here, and mineralization by the matrix vesicle and not by the matrix vesicle here. And cementoid tissue. Okay, so cementoid means it is a thin layer of the cementoid that can usually be observed on the cemental surface. Okay, and when old cementoid layer mineralized, new cementoid layer is formed, and cementoid tissue is lined by the cementoblast. Okay, so this is not quite important, but as I have discussed in the difference. Okay, so in this difference you can just remember, so cementoid is absent in this AEFC, but it is present in the CIFC. Okay, and the cementoid means it is a thin layer. Okay, it is thin layer of the cementum. Okay, that is usually observed on the cementum surface. Okay, at the surface of the cementum you will just see this cementoid tissue, cementoid, and when the old cementoid layer is mineralized, new cementoid layer is formed, that is quite similar with that of the predentine. Okay, okay, so we have covered with the every aspects, every subtopics of today's video. Okay, and in this video the thing that I have discussed, okay, among all those stops, the main thing you should remember is the classification, Schroeder's classification, which is one of the most important topic of this chapter. And also you should clear all your concept. Okay, what is cellular, what is ocellular, what is extrinsic fiber, what is intrinsic fiber, okay, from where it is derived. Okay, after knowing that, after when you will know the foundation, you will just be master in this Schroeder's classification. Okay, so the names are enough to know about that cementum. Just like cellular mixed stratified cementum, CMSC means cellular, means cell are present, mixed means both extrinsic and intrinsic fiber are present there, stratified means in strata. Okay, so I think I have been successful in explaining all those critical concepts of this classification of the cementum to you all guys. So and I request you to watch all those parts, okay, of the, if you want to watch this chapter cementum, then just watch all the parts, okay, because I think I am just relating all those parts. Okay, so you will be having a proper mind mapping. Okay, so you can do a mind mapping in that chapter, and you will just rock it in that chapter. Okay, okay, so I will meet you in the next video. Till then, stay happy, stay healthy, and also for the notes you can visit my Telegram channel, and the link of the Telegram channel is in the description below. Okay, so we will meet in the next video. So tata, bye bye, thank you.